Okay, EMS system. This is a system of complex network coordinated services that provide various levels of care to the community. These services work in unison to meet the needs of the community. The EMS system begins with system involvement. You first need to dispel the misconception about EMS and educate them on the truth. The public needs to be taught how to recognize what is an emergency and what is not, because there are a lot of non-emergencies. Crap, come back. Is that, no, come back. There are a lot of emergencies that are not actually emergencies. So they need to be taught how to recognize what it is, activate the EMS system, provide basic care. The public usually does not have medical training or knowledge, obviously, and the public also, a simple cut may be an emergency to the caller. Do not become angry if the patient calls for a non-emergency, because we'd be angry a lot. Be compassionate and caring with your patient, and we will build the patient's trust of both you and the EMS system. We had a girl that was freaking out because she stepped on a tiny piece of glass yesterday. She's like, I think I need a life alert in case this ever happens again. And of course, I didn't say anything. I never say anything. I'm not burned out yet. Lecture outline: factors that play a role in determining the outcome or likelihood of your patient's survival includes bystander care. Dispatch, including pre-arrival directions. So if someone needs CPR, dispatch can do EMDR, EDR, something like that. They'll tell the person to do resuscitation over the CPR over the phone. Response, both mode and distance. Pre-hospital assessments and care provided at the level of EMS trained personnel. Transportation, ground-based ambulance, critical care units, air transport, definitive care, including trauma, pediatric, and neurological specialists. Rehabilitation. The public's first contact is usually the dispatcher, requiring that the dispatcher's training vary greatly from state to state. They often cover police, fire communications, and all general department call phones. Dispatchers must interpret the caller's needs. They must determine if it is an emergency and determine the resources that are needed to be sent. The scene may be different from what was relayed to the dispatcher. Never under or overestimate information. Never get angry with dispatch from their information. According to what you see on scene. Yeah, obviously. So you could be called to something that is, what was it? We went to the high school, I should probably not say which or names, but basically we went to a high school. It was, I think it was, someone passed out. So super chill. Like, we still went emergency, but we have to navigate and walk through this high school. And before we walked in, one of the medics, he had a feeling. He's like, I'm going to bring this auto pulse just in case. I'm not sure. And it'd be a far walk back to the ambulance. Not far, but far enough to where seconds matter in the case of someone being unconscious. So we walk in, and they're holding doors for us. No one says anything yet, but, we're walking with haste, but also making sure we don't, slow is smooth is fast. We're not going to trip on the way there. And we turn the corner, and we see a lady doing CPR. And a couple people like yelling. It's kind of a blur a little bit, but my acting captain, he runs back to go grab the med box and the airway bag, and we go ahead, we hook up the pulse, auto pulse, and I go ahead and lube the king tube, stick it in, secure it, and we go to work. It was a person that was down doing CPR. Anyway, happy ending to that story. He got back. He was walking in the hospital 2 days later, and he actually came to visit us at the stations. But seeing him the way he was, normally those people don't come back, is what it looked like. He didn't even have a pulse, I believe. I can't remember. It was a blur. But yeah, point of that being is you never know when you might need all of your tools, all of your equipment, so don't get lazy with it. You have the manpower, you have the people, bring everything. If you're acting captain or lieutenant, if you're not, then just do whatever your lieutenant says, do whatever your captain says. I've been learning that lesson this whole year. As a paramedic, you must develop your care plan. Ask yourself, does the receiving facility have the resources needed for this patient? If not, then ask if there's an appropriate facility with a reasonable distance. Consider the patient's request for a certain facility. If it is different from your facility you feel would be more appropriate, do not argue, but educate your patient, especially if they need a trauma center. Levels of education: federal at the local level of EMS functioning, the federal level, NHTSA, the National Highway Transportation something, created the National EMS Scope and the Practice Model. Provides overarching guidelines as to what skills will reach the levels of EMS providers should be able to accomplish. At the state level, licensure is usually a state function. Laws and regulations are enacted to specify how EMS providers will operate. Licensure is controlled at a state level EMS administration offices, and the services local to the regional medical director develop a set of patient care guidelines that outline the approved skills and treatments at each level. Keep in mind that every state varies on the role that the medical director is able to do, so ensure that you understand your state's processes. Local level medical directors decide day-to-day limits of EMS, such as the medications that will be carried on the ambulances and the patients that are transported. I guarantee you, there's going to be a question separating these governments, and it's going to ask which level of whatever is under which government or something like that. I feel like this is important. Consistency. As a result of the national guidelines, the medical director can limit the scope of practices. Expanding the scope of practices requires state approval. The national standard of curricula for all levels revised in the National EMS Educational Standards, NHTA, whatever that is, Federal Administrative Sources, covers 4 levels of EMS providers, can be downloaded from the internet. In your free time, that would be fun to read. The dispatcher, she plays the crucial role. He or she must receive and enter all information on the call, interpret the information, relay it to the appropriate resources, may be trained as an emergency medical dispatcher, has an added task of giving simple pre-arrival instructions, cardiopulmonary resuscitation, bleeding control, asking a series of call-related questions to the caller. The goal is to benefit the patient until EMS arrives. Emergency care medical responder. The first responder, formally. All right, not all states have this certification and or licensing level. Considerable variation between requirements and allowed skill depending on the state. An EMR, usually trained in CPR or first aid. In some states, EMRs can function only as a part of organized group that the group affiliate must be transporting ambulance services. So acting with other paramedics or EMTs in some cases. You should familiarize yourself with the level of training of EMRs in your system so you know what they're capable of and not. To recognize the seriousness of a patient's condition, administer appropriate basic care, relay information to the paramedic, and EMRs are essential to level of provider care in rural areas, especially because nobody else is there. EMT, formerly called the EMT Basic or EMTB. The EMT is the backbone and primary provider service of many EMS systems. Go ahead and read this for a second. Providers must be EMT certified before entering the paramedic educational system. Much life-saving care is provided by the EMT, BLS before ALS. Skills and treatments vary from state to state. In some states, EMT could be trained in advanced airway intubation, air Qs, LMAs, king tubes, limited medication administration, probably giving you your own inhaler so you can breathe it, or giving you your own nitro tablets so you can consume them. Actually, I think we might have those. Aspirin, we can give aspirin. What else? Doesn't matter. Oral glucose, we'll give you a stick of sugar, you can eat that. We are highly trained. Even if they have expanded the scope of practice, EMTs are not recognized with the difference in certification level per the National EMS Educational Standards. More providers are trained and certified at this level than any other level in the EMS system because it is easy-ish. Advanced EMT, the AEMT, formerly called the EMT Intermediate, EMTI, initially developed in 1985. A major revision took place in 1999. Recent changes in the paramedic scope of practice, EMTI, with the AEMT level in most states. More advanced pathophysiology. Some advanced procedures such as establishing IV access, administering IV fluids, performing blood glucose monitoring, administering several medications, performing some advanced airway management. Interesting. The paramedic is the highest EMS skill level to be certified or licensed at the national level. Major revisions to the curriculum in the 1998 increased the level of training and skills greatly. To test through NREMT, a paramedic student must have attended and successfully completed training at an accredited institution. States that do not employ NREMT may not require the institution to be accredited. Interesting. Even if one holds a license or is certified independently, states will require the paramedic to function directly under the guidance of a licensed physician, be affiliated with paramedic level of service, and some states allow paramedics to complete further education and earn the title of critical care paramedic. This varies from state to state. Search your state laws to see if this is allowed. So as far as paramedic education goes, most states base paramedics education programs on the National EMS Education Standards. We are on slide 37. As part of the 2009 revision to standards, inclusion at a college level of anatomy physiology course was recommended as a part of training in the program. Some training institutes follow this part of paramedic training program. Others require it as a prerequisite. Mine did not, and I have a whole slide. I haven't made it yet. We're in the bones section right now, but that is my requirement. States require varying hours of education. State average falls between 1,000 and 1,500. We have 1,200 in Florida. Combined classroom, clinical, and field education. Some leaders want structured paramedic education, so it is achieved through accredited association or a bachelor's degree program. Heck no. Continuing education. Most states require the paramedics to complete a certain number of training, education hours, and refresher programs to keep you up to date on any new research findings. New techniques, skills, how to prevent degradation of skills, use less frequently, showcase current issues in your state, and affect how your system's ability to provide quality emergency medical care services. Consider attending conferences targeted towards nurses or physicians. Keep up with reading EMS journals and research publication. At that point, dude, I'm gonna start getting my PA. Consider continuing education organizations that are accredited through the Commission Accreditation for Pre-Hospital Continuing Education, or CAPSE. There are too many acronyms in this. Formerly called the Continuing Education Coordinated Board of EMS, or the CECBEMEMS, because I'm sure you care about that. Developed continuing education standards is involved in setting accreditation standards for the pre-hospital care providers. Get everyone in your service involved in post-run critiques. Honestly, yeah, that's good advice. Whenever there is a call that is complex and is not the run-of-the-mill pick up grandma and put her on the couch, then yes, you should go over why did you give this medication, shock with this, why didn't we do this, X, Y, Z. Good advice. Responsibility for continuing education ultimately rests with each individual paramedic. You know the areas of your knowledge that is diminished. For me, it is IVs. I suck at IVs. Continuing education helps ensure problems do not occur in the field. If something does go wrong, offer the call after the call is not the time to realize that you should have done something differently. Absolutely. Always check your gear, check your bags, check your PD bag, check your airway bag, check all of your equipment. Maybe, make sure it's up to date. If something's not there, the moment that you need it, that could be the only call your entire life that person that is unconscious needed what you forgot to see was in the bag. and if that person is under 12 years old, you live with that. Continuing educational materials may help ensure that you have the following latest practices and build confidence in your skills. Additional types of transports. We're going to do one more of these slides. I can't. Many EMS include specialty centers focusing on specific types of care or specific types of patients. Examples: trauma, burns, poisons, cardiac, psychiatric conditions, and pediatric patients. Also, bariatric units. Specialty centers normally have in-house staff, surgeons, and other specialists. Other facilities must page surgeons, specialists, etc. from outside of the hospital. Typically, only a few specialty hospitals are in a region. Transport time to a specialty center may be slightly longer. Good, we're still up. Maybe slightly longer in rural areas. Sometimes the medical air transport will be necessary if we're going to a highway accident, multiple car pileup. We're not even there yet. We're gonna go ahead and tell Air 1, hey, rotate the helicopter, get up in the air because we might need you. Just so that way it speeds up that time for someone that will need to be life flighted out. Local, regional, state protocols may guide your decisions. Interfacility transports. The transports are used for non-ambulatory patients with acute or chronic medical conditions requiring medical monitoring. May include transferring patients to and from hospitals, skilled nursing facilities, board care homes, home residents, or AF assisted living facilities. We have so many of those in Tampa. The patient's home and well-being are your responsibility during ambulance and transportation. If medical control is required during transport, it comes from a transporting facility until you arrive at a receiving facility and hand off the care with a report. You should obtain the patient's medical history, chief complaint, latest vital signs. You should also provide ongoing patient assessment. In certain rare circumstances, a nurse, physician, respiratory therapist, or medical team may accompany you with the patient, especially if the care is needed to extend beyond the scope of practice. One more. Working with other professionals, working with the hospital staff. These are amazing, loving people who are never rude and only want to help you. So become familiar with receiving hospitals, and you will transport by observing the functions of the staff member, their normal operating procedure in all areas of the hospital, especially the emergency department. This experience will help you understand how your care influences patient recovery, the importance and benefits of proper pre-hospital care, the consequences and delay of inadequate care or poor judgment. You will know if you have any of those. Interact professionally with all hospital-trained personnel who will be a part of your patient's care. Never ridicule, undermine any member of the hospital staff. Remember that the care the patient receives in the hospital may differ from what you do in the field. You may consult with appropriate medical staff by using the radio through established online medical control procedures. Through these experiences, you will become more comfortable using medical terms, interpreting patient signs and symptoms, developing patient management skills, and the best patient care occurs when all emergency care providers have closed report. Now, that being said, hospital providers, nurses, nowadays way overworked, understaffed. Absolutely. They're dealing with stress just like you're dealing with stress, right? Like, we all deal with stress in different ways, and they might be having a terrible day or not know how to manage their stress as well as you can. Vice versa too. So keep that in mind whenever one snaps at you.